Welcome everyone, and thank you for joining us this fine Friday afternoon. We see folks are starting to sign in here. My name's DJ Wells. I'm with the Mensa Research Institute and with Mensa Medical, and we're here today to talk with Dr. Albert Mensah and Dr. Perry Passaro about coping with anxiety, depression, a lot of things that we're all wrestling with right now as we are faced with these uncertain times, as we're faced with the reality of staying in place, of social isolation that has resulted from the COVID-19 outbreak. And so we want to share with you a little bit about things that you can be thinking about to manage your stress, to manage the anxiety and the depression that you may be dealing with, coping with families, all those things that we're dealing with as we're part of this new normal of social distancing and such. So just a quick introduction for Dr. Mensah and for Dr. Passaro. Dr. Mensah, Dr. Albert Mensah, is the co-founder of the Mensa Medical Clinic in Warrenville, Illinois. It's a clinic that specializes in the treatment of biochemical imbalances and the cognitive and physical disorders that are caused by those imbalances. As a physician in this field since 2005, Dr. Mensah has treated well over 35,000 patients using all natural, non-pharmaceutical nutrient therapy. His practice includes the management of cognitive disorders such as autism, behavioral and learning disorders, eating disorders, bipolar disorder, anxiety syndromes, schizophrenia, Alzheimer's disease, and much more. Dr. Mensa received his undergraduate training from Northwestern University in Evanston, Illinois, and his medical degree from Finch University of Health Sciences, the Chicago Medical School. Dr. Perry Passaro has taught at the university level and lectured about cognitive behavioral therapy for several years. Dr. Passaro integrates new findings from CBT research regarding Eastern wisdom teachings and acceptance and commitment therapy into the traditional CBT, CBT therapy, cognitive behavior therapy. This orientation has grown from Dr. Passaro's extensive personal experience in Eastern philosophy, having been a regular meditator, having participated in meditation for over 35 years. Dr. Passaro has also worked in public education for over 20 years, primarily as a school psychologist. He is recognized by the courts as an expert witness in the areas of school psychology. He's been identified as one of the top 10 psychologists in Orange County, California, and he is his practice is with the Anxiety and Depression Center in California. Thanks to both of you for being with us today. Just a couple of ground rules so that folks know what to expect today. There is on your webinar tool a Q&A function. If you click on that, you'll be able to type in questions. And so what we're going to do is we're going to allow Dr. Mensah and Dr. Passaro to spend a few minutes kind of sharing some general insights about this important topic. And then we're going to open it up to questions. We really want to spend much of our time today answering your questions about this important topic. And so now that I've butchered both of their bios extensively, we'll go ahead and turn the floor over to Dr. Mensah and Dr. Passaro. Thank you so much for joining us.
Thank you, Mr. Wells. First of all, I want to say, judging from the background, we can tell who's in Chicago and who's in California right now. So, Dr. Passaro, bless you. You folks out there, who've seen us, that we deal with biochemical imbalances and those types of things. And we also know that this process is not an overnighter. I am really excited to be talking to Dr. Passaro today because he deals with issues, and today he's going to bring to us tools that we can use starting today with beneficial effect that can take us through this process of the anxieties, working with coping skills for depression with, as Mr. Wells said, this new normal, which I hope won't be normal for long, this new temporary situation, which involves us all being sort of sheltered together, is stressful. And everything we hear about what to expect in the next coming weeks is stressful. Yet as parents, we have to be there and be strong for our children, yet we have to cope ourselves. We have to be caring of our spouses and significant others, and yet we have to also gird ourselves as well. And let's not forget, we have to take care of our children. They depend upon us for support emotionally, environmentally, and everything, what other way you can possibly think of. So I'm really excited to have Dr. Passaro on board. He is a man of wonderful vision and a gentleman, and a professional, consummate professional in his field. I'm very, very excited because what we've understood for a long time now is that, it's one thing to do nutrient therapy and it takes its time, but it's another thing to have some level of support, emotional support, as you're moving through those other therapies. So Dr. Passaro, first of all, I want to thank you so much for your time today. And we're looking forward to some great and exciting things. And for a change, I'm not going to say a lot during this webinar. I want Dr. Passaro to have plenty of time to share with us many of his tools and skill sets. Dr. Passaro.
Thank you, Dr. Mensa. It's really a pleasure and honor to be here with you. And I think that, there were so many things that you said that really in many ways summarize what I want to talk about. And one of them is this idea that we need to realize that this situation is temporary. Our minds tend to want to go into a place of permanence with these unfortunate circumstances, but it's very important that we're telling ourselves that this too shall pass. This is not permanent. That's a very important thing for us to keep in mind. We need to tell that to our children and to others that are struggling. This is temporary, this too shall pass. One of the things that I'd like to do is give a little diagram that sort of lays out the thinking errors that occur when we're feeling depressed, when we're experiencing anxiety, or when we're trying to manage our anger. So what I'm going to do here is move temporarily to this feature of sharing the screen. And then I'm going to show you a slide that I hope everyone can see well. And these are the things that we want to talk about, and we want to give people this insight so that they can be aware when they're experiencing this, and then we're going to really work on tools to be able to make changes in this. So, and I know today we're going to focus primarily on anxiety, but we do want to touch upon depression, and we'll talk about that next week in more detail. But just to highlight the three major topics that I think we'll be addressing over the next 2 weeks. What we understand in regard to neuroscience and cognitive science is that depression is made up primarily of negative thinking. And this negative thinking centers around a negative view of ourselves. And in this case, it would be our inability to manage the challenges of the current situation. I'm not good enough. I'm too weak. I can't do it. A negative view of ourselves. A negative view of the situation. It's too much for me. It's too much. I can't take it. And a negative view of the future, going back to what Dr. Mensa said, feeling that this is permanent when it is not. So this negative view of the future, that this is never going to end. So these are common thought patterns that many of you may have experienced or may be experiencing. And given that we're all human beings, we probably have at some point in our life. In regard to anxiety, we know that there are certain thoughts that are paramount. And these include danger, fear, and negative predictions of the future. Certainly, this is what you would expect in situations like this pandemic. This overwhelming sense of danger and fear, and that terrible things will happen. And then in anger, there's a sense of this shouldn't be happening. It's unfair that it's not supposed to be this way. Now, these all, even though they've been laid out for you in this way, it's really not this clean. They all blend together. We can be depressed and anxious almost simultaneously and back and forth like a pendulum. Anxiety feeds anger, and anger can feed depression. Many people that are depressed, really, you don't see that sense of, oh, they're just laying on the couch and can't get up. You can have very irritable forms of depression, and I've certainly experienced that in my life. And I think most of us have without maybe even knowing the cause. So irritability can certainly be a manifestation of these, as well as, you know, even extreme anger, verbally abusive and emotionally abusive when we're just overwhelmed by all this. So I think just being able to understand that these are some of the common core cognitive experiences that we have in these difficult situations allows us then to be more aware. And then we'll talk about how to work with those. So let me come back to all of us. So one of the most important things that we want to think about in regard to these situations and these thoughts that we have is that we often believe these thoughts to be absolutely true. And so it's so important that what we do in part is look at the facts to see if our thinking is true or not. Because when we're overwhelmed emotionally, then it's very hard to access our best thinking. So it's vitally important that as we're seeking information, particularly in areas that we're not an expert in, we need to be able to turn to people like Dr. Mensa and Mensa Medical to be able to understand what the facts really are, and other strong, reliable sources like that. We need to seek facts and not go with these intuitive feelings we may have, or really poor choices in regard to social media and finding, you know, information that just heightens anxiety instead of information that really helps us find facts. So I think that's vitally important. Let me share the screen again, if that's okay. And then I'd like to show something that I hope will be helpful. In regard to anxiety, when we're experiencing anxiety, we're experiencing multiple things simultaneously. We're experiencing the catastrophic thoughts that I've identified, also the physical sensations and the strong emotions. And these can lead to panic symptoms where we feel that we can't breathe. We feel that we may be having a heart attack. We feel that we have the disease when we don't. We can create that within ourselves just through our thinking and our fear. If there's one thing I've learned in my career since 1989 of doing this type of work is that our thinking can make us better or worse. And so it's so important that we become more aware of our thinking, because that is something we can change. We can't change this pandemic, but we can change our thinking about it. And by changing our thinking about it, we can change our emotional state and our behavior. And that not only helps us, it helps everyone that we're living this life with. And this is certainly Dr. Mensa's area of expertise, but one of the things that's important to understand in this is that the areas of our brain that are taking control when we're anxious are the emotional centers of the brain, and we are not going to be at our best when those centers are taking over, because those centers are centered in fight, flight, or freeze. And we're not going to be our best when we're fighting with others. We're not going to be our best when we're running away from problems. And we're not going to be at our best when we're paralyzed with fear. So we have to work to get ourselves out of that state when we recognize that we're in it. So what I hope to talk about today and next week are some strategies that we can use to help reduce anxiety. And these include breathing activities and meditation practice, mindfulness practices, changing our thinking, as I said, with factual information from reliable people that we trust, like Dr. Mensa, and then working through an idea of being able to identify the best that can happen, the worst that can happen, and the most likely to happen. When we're in these situations, we tend to ignore anything other than the worst that can happen. And the worst that can happen is usually not what happens. The best is probably not going to happen at this time either, but it is so important to really work to find what's really the most likely to happen. And that takes work. And then the other thing that we want to talk about is something called a fear ladder, which is really being able to identify those things sort of in a progressive hierarchy of our fears so that we can understand those and then make efforts to work through that fear ladder. And then finally, this idea, which is really so important in regard to the treatment of anxiety, and particularly in situations like this where we don't have the control that we'd like to have, is the idea of acceptance and commitment. We have to accept what we can't change and make a strong commitment to change what we can, and to have the wisdom to know the difference between the two. It's the
Yes.
Serenity Prayer.
Mm-hmm.
Dr. Passaro, if I can jump in here for just one quick second. And
Please do.
and I'm only doing so because we had a specific question about this. Someone has asked, are we recording this? Because this information is so great that folks are going to want to go back to it. And so I do want to point out to folks that, yes, we are recording this broadcast, and we will upload it to YouTube later on this afternoon, later on this evening. And also make links to that video available via the Mensa Medical Facebook page. But I also want to note, I know that Dr. Passaro is going to be guiding us through a meditation exercise a little bit later on during this broadcast. And so if you want to participate in that exercise live with us in say half hour, 45 minutes or so when we actually get into it, you need to take your computer and find a quiet space. But if you can't do so, because we are recording this, you can then go back and replay Dr. Passaro's guided meditation whenever you need to make use of that tool to get you in that meditative state. So just want to point those things out now for the folks that are watching, that we are going to do some guided meditation today, but also that there will be a recording available so that you can access it whenever you need it.
Thank you. And one of the things I'll do before we're done today is point everyone to our website, where we have about 20 guided meditations that you can use. And then next week I'll have some meditations that are apps that I would recommend that people could explore as well. So
And
go
I'm
ahead.
sorry. One other
No,
thing
please.
that I want to jump in here with another question, and this is one of my own questions that I want to pose to Dr. Mensa, because I know that you've expressed this a couple of times, and I want to make sure that it doesn't get lost. Dr. Mensa, you've expressed this on some of the other broadcasts that we've done related to nutrition recently, and that is there are some natural supplements that we can rely on in terms of helping with some of the stress and anxiety that Dr. Passaro was talking about. So yes, we've got some tools that can help us in terms of behavior modification, but there's some nutrient tools that we can access as well. Could you speak on that for just a second, Dr. Mensa?
I will, but I'm going to push that off till the end when we're working with all of our tools. I was really very intrigued by what Dr. Passaro was saying, and I want to get him back on track. So, no offense, Mr. Wells, but
No worries.
I'm actually sitting here wondering, okay, more and more and more. What's next? What's next? So, Dr. Passaro, if you could please resume there. Thank you, Mr.
Okay,
Wells.
thank you. Thank you. So I think that, it's a wonderful time, though, to stop for a second and talk about the body-mind connection, because these things are absolutely related. The more we stay in these states of anxiety, depression, and anger, then the greater that effect is having on us from a standpoint of the stress response, oxidative stress, the type of work that Dr. Mensa does. And so we want to understand that we can be, following the excellent guidelines that we've received in the past few weeks through nutrition and through supplements. But if we're putting those things in our body, but mentally we are still allowing ourselves to kind of run in this panicked state, then we're still having a negative effect on our body. So it is so important that we really work on both of these things simultaneously. And so just to explain that a little more, and Dr. Mensa can explain this much better than me, but there are two basic neural pathways in the body. There's one that is this fight or flight pathway, which we need at times. We absolutely have to have that, but we don't want to live in that. There are times when you need that. If you're driving a car and it slips on the ice, you want to be able to do the right thing. If there's an emergency in your home, you want to be able to do the right thing. You need to be able to have that. And but you don't want to live in that state. You don't want that to be a chronic state. You want to live in a state of calmness as much as you can cultivate that, which is the opposite neurological state. And we have these two states running within our nervous system, and we want to observe, which state am I in? Am I in this fight or flight type of state, or am I in this calming state? And when we become more aware of what state we're in, then we can notice that, and then we can utilize the tools to bring us back into this calm state, because you're never going to make the best decisions when you're in this state of chronic stress, when you're in this state of living in this what's called the sympathetic nervous system. We want to really be in the parasympathetic system, the calming system. That's the state we want to live more in, because that's when we can be much more in our true selves, as opposed to the self that nobody really wants to be around or living with, and including ourselves. We don't want to be in that. So it's so important to notice which of those states that we're in, and to really be able to learn to operate within those, and have the tools to fluctuate with that. So
Dr.
what I'd go ahead, please.
This is why I'm so excited to have you today. I'm so thankful. So many of our patients, so many of the people that we deal with live in those states, and it's hard for them to pull themselves out of that vicious cycle of emotionality. And as you said so wonderfully, they make bad decisions because they're coming from a place of current emotional flux, as opposed to trying to move into a space of calm. And much to many credit, for folks out there, many people do try to get out of that state, but don't know how to do it. So I'm so glad you brought that up in sharing with them that, a lot of the decisions they're making really aren't their fault per se, when they're stuck
Absolutely.
in this entire rigmarole. So I'm so grateful that you brought that up. Please continue.
Absolutely. Yeah, I couldn't agree more. And the thing is that I work with people of all ages, young children, adolescents, adults, and what most school age young people will say to me is, why isn't this in the school curriculum? We should all know this. We should be learning this. But unfortunately, in our society, we know this information, but what often has to happen before anyone finds out about it is you have to be in kind of a crisis state, and then you have to go to a therapist to find out about it. And it's the same thing, you know, with the type of work that you're doing, Dr. Mensa. It's that, you know, I mean, people don't come to you if everything's going okay. It's when things are going badly that they come to you to find out, oh my gosh, I've been eating all the wrong foods all these years and I haven't been taking proper care of myself. And certainly some of these things are beyond their control as well. But that's the beautiful thing about this type of webinar and the work that you're doing, giving people the information that they really need to live their lives fully and in health, both physical health and in emotional, psychological health. So what I'd like to do is use a really high-tech presentation now with And this is really one of the keys. And I wanted to do this because it is so simple, in theory. But some of the easiest things that we can do to help ourselves is to realize, where is my mind right now? And we will see that we spend most of our time obsessing about the past and mistakes that we may have made and things that we'd like to change from the past. And then in the future, catastrophizing, worrying, predicting. And if there's one thing that people come away with today, it would be my hope of understanding this simple chart. Forget the past. It's gone and we cannot change it. We cannot control the outcome of the future, nor can we predict it. If we could predict it, we could all go online right now and go to some, you know, gambling site and we'd all be rich. We can't predict it. Where we want to learn to live is in the present moment, because only in the present moment are we truly living. It's only in the present moment that we can change anything. This is where, if we make an effort in the present moment, the future will improve. This is where we want to live. If people get nothing out of this but the understanding that, oh wow, I do spend most of my time in the past or in the future. And if I can live more in the present moment, everything will improve. Because if we're living in the present moment, now, even though there's a pandemic, even though we may have chronic health problems, even though there may be challenges in our lives, which all lives are going to have, if we look at it carefully in the present moment, whatever we're dealing with is manageable. It's when we move into the predictions about the future that it becomes unmanageable for us, because we've just magnified it. So the one thing I really hope everyone will take is, I need to make an effort to live more in the here and now. And by doing that, in this difficult time, now we're more present for our children, our significant others. If we're living alone, then we can be more present in our own lives and in other people's lives that we're touching. But if you think about it, one of the things that I notice with the young people that I work with, they're not trained to be present. They're sitting across the table having a meal with one another, sort of, and they're just texting, someone else. And if we watch closely, we're doing the same kind of things. It may not be quite as obvious as this, but are we really present and available for one another? And if there's something good that can come out of something like this pandemic, it could be the idea that life is very short, life is very precious, human life is such a gift, and let's try to live it fully and completely in the here and the now, because that's all we really have. So that is such a crucial variable in regard to the work that we're going to talk about. And I think, Dr. Mensa, you would agree that it's a key to physical health as well.
Dr. Passaro, I could not agree with you more. I mean, that was so powerful, living in the present. We so often forget that when, many of our patients and even ourselves, when we start to ruminate about things from the past, we're detracting from now. We're stealing are every second that we don't get back. We don't have time machines to get back to be able to undo things, and depending on which versions of physics you believe in, you might not still come back and be the same person if you go back in time anyway. So, living in the present is so important, and all this anxiety and all of these ruminations steal from that. I'm so glad you brought that up. And the other piece about some of the positive, I hate to say it this way, but some of the positive aspects of this pandemic that we're living in right now. We have a chance to sit down and rethink some things from every level. I'm not going to get into politics, but literally from the top down, how we manage our lives, our society, our culture. I gave the example yesterday of two senior individuals in the bedroom, both of them with iPads and hardly paying any attention to each other. So that's time that they don't get to relate to one another. And now we're sitting in a space where, gosh, you can only watch a screen for so long, and then you get stir crazy. And now we're kind of having to sit down and say, hey, what can I do differently? How do I navigate these waters? Oh, I'm sorry, you're that person I married. Okay, let's reintroduce ourselves. Gosh, when was the last time I actually had a real conversation with Junior or Juniorette and listening to what it is they've had to say? I experienced that myself with my youngest. I sat back and I said, my gosh, he's growing so fast. Usually in the movies, Dr. Passaro, we see people talk about at the end of time, how quickly time goes and how we missed the best years of our children growing. And we're sitting here intentionally ignoring those kind of interpersonal interactions. The generations that came after some of us are so intertwined with technology. That's their form of communication. And in situations like this, they freak out. They don't know what they're supposed to do.
Right.
How do you actually talk to someone? So I am so glad you brought this up, because it is an area where we really have to reconsider how we think, not how we emote, but how we actually think about these situations. And I know you're going to provide us some great tools on this.
Absolutely, thank you. Yeah, and that's the key to cognitive therapy. It's the key to cognitive therapy is understanding, that really, although there are difficult situations, it's primarily our thoughts that are the problem. And when you think about, when I talk to young people, and many people for that matter, they'll say, well, being, left at home like this is boring. And I mean, I think that's understandable if you grow up in an age where you're expected to be entertained every few moments. But if we really want to get in touch with life as it really is, as opposed to this fantasy world, then just, it's one of the reasons that, that I chose to be outside today, to be out in nature, to be able to really be present in nature, to hear the birds singing, to see, the plants that are blooming. It's about the simple pleasures that are around us all the time. Really, instead of just slamming down a drink, can we really take our time and really enjoy it and really participate in it fully? That's really what mindfulness is about. And so let me, if it's all right, I think I'll maybe put up a few slides that hopefully will be helpful in regard to this point. This idea that we're talking about of living in the present moment it sounds very simple, but it's about this idea of doing one thing at a time with full attention. It's being fully present in what's happening now, even if it seems like it's a very simple, mundane task, like washing dishes, folding clothing. It's about doing anything with full attention and not multitasking. One thing at a time with full attention, not multitasking. The Zen master Thich Nhat Hanh says the greatest thing that you can give anyone in this world is your attention and full presence. And one of the things that I notice in therapy over the years that I've been doing this is that as I've learned these practices for myself, I can be fully present for people in therapy. And I think just that alone makes a difference for them. And people will say to me, I don't often feel heard. I don't often feel someone is giving me their undivided attention, that there's certainly nothing special about me. Any of us can learn to do this. Now, the problem becomes that our mind wanders back and forth. And so, how do we come back to being fully present? We have to be able to come back again and again and again to the present moment. We have to observe when we're not fully present. And we have to investigate, what is it that my mind is obsessing about, ruminating about, that's keeping me from being fully present? We have to remember, the mind is a problem-solving machine. And if all we're going to do is think, and all we're going to try to do is problem solve, then that's what our mind will do. It'll follow our lead. So the point that I'm trying to make here today is an idea that's very foreign to most people. We do not need to be thinking all the time. We can take time in our lives when we do not need to think. We just need to be. It's what being human is about, being. It's not about thinking all the time. But the key to being able to come back to the present moment means that we have to have tools to do that. We have to be able to find a way to bring ourselves back to here and now. The way it's commonly taught is through the senses and through the breath. So the idea of just, when we notice that I'm in the future or I'm in the past, I'm, overwhelmed with worry, or I'm thinking all the time, it's noticing that. And we'll work on this a little bit. And our website has lots of help with this, and there'll be other apps, as I said, that I'll introduce. But a simple way to think about this is, when we notice that we're not fully present, when we notice that we're not when we're overwhelmed, then just stop for a second, and no one needs to know. And then just take a few breaths. Because what this does now is it takes us out of this sympathetic nervous system, this activating fear-based system, and it brings us back into the calming parasympathetic system. And so just a few breaths, but we have to put our entire concentration on the breath. So it's very good to just quietly breathe through the nostrils. We want to take a long, slow, deep diaphragmatic breath, and then quietly, slowly breathe out. And we can do this in several ways. We can just focus on the breath itself. We can count. We can do a count, counting in and then hold, and then breathing out to the same count. I'll talk about some other breathing techniques in a minute. We can just breathe into a count, or we can utilize a mantra. We can say something as simple as breathing in, breathing out, because this gives the mind something to focus on that's present. We can also breathe in and say to ourselves quietly, calm, safe. We can find anything that resonates with us in this technique, but this simple and powerful technique can bring us back to now. And when we're in the now, we are going to be our best. I know this seems like, kind of hocus pocus sorts of things to some people, but here's an interesting thing. I served in the Navy about 45 years ago, and they actually taught similar ideas even back then, that if you're in a dangerous situation, you need to be able to breathe and calm yourself down so that your training will allow you to step in, as opposed to becoming overwhelmed with panic and then making a mistake that might result in harm to yourself or others. So this is grounded in solid science, and it's also grounded in philosophies that have existed for thousands and thousands of years.
You know, that's very interesting, Dr. Passaro. Again, thank you so much. The commentary about your experience and what you were taught in a different environment, you know, many of our traditional martial arts that are taught for many people, even though these are areas of combat or what looks like combat and aggressiveness, certain martial arts will also emphasize that you're really doing everything from a place of calm. And that is and what I'm getting from you and just thinking about this now is that they're saying you have to be present for every moment in order to appropriately defend yourself. If you're in a state of panic, you're going to miss cues, you're going to misinterpret it, and that can lead to a negative outcome. And of course, Tai Chi and Qigong, those are areas where it is about being present and coming more in tune with your body and really learning to come together with flows of energy and all sorts of wonderful things there. But being present is so huge, and I thank you for that. Even as you were talking through it, I was simply doing it. You can't help but it. It was a great exercise. And I want people to be aware that something you said was also very key. Being human has in it the word be, not the word think. We're not thinking human. We're being human. And we've gotten so much away from that. And that has produced really an arithmetically and geometric change in how we comport ourselves in life. And it hasn't been for the more positive. So it's a great time, and thank you. That was awesome. What do you have next for us, Dr. Passaro?
Well, I think maybe let's go to this. So I think that in regard to being able to work on this idea of mindfulness and acceptance, what I have, and I'll point everyone to where we can find this, is there are exercises that we can do to try to cultivate acceptance of what is instead of fighting it and resisting it. And so I'm going to point to a few worksheets that might be helpful to people and how they can access these at no cost through our website. And so what we can see here is that it's a journaling activity. And we ask people to identify difficult situations, strong negative thoughts, negative moods that might be affecting them, and to make these observations about their resistance and to be able to make changes that are allowing them to work on the idea of accepting what they cannot control. So I won't go into a great deal about these worksheets right now, but I'm going to just have people be aware of them, and we can certainly talk about them. One of the things that I know that I see a great deal of in the popular literature right now, when people ask questions, particularly of psychologists, about what can I do at these difficult times, one of the things that cognitive therapy teaches is the idea of activity scheduling. And so, and activity scheduling is about creating a balanced life for ourselves. And so I can't really stress that enough. A healthy life is a balanced life. And so, and I know that from a medical standpoint, I'm sure you tell your patients that all the time. So we want to make sure that people are having pleasurable activities in their lives, particularly if they can focus on simple pleasures, such as being in nature, walking. These are such healthy activities. Things that we want to accomplish, and making time to list these and to work on these, and then making time for them, but not allowing these activities to overwhelm their life to all they're thinking about is what they need to accomplish. There's a time for everything, a place for everything. Looking at things that we might be avoiding, that's very important. We want to approach that with a sense of fearlessness, this ability, the fear ladder that I talked about. We want to be able to look at these things that we're avoiding. And then we want to make sure that at this time, this difficult time, we're living by our values. Because if the emotional brain takes over, this is where we're going to do things like be that person in the supermarket that wants to hoard all the toilet paper. You know, it's about living by our values in these difficult times. Activity scheduling, as I hope everyone can see, is really very simple, and many people may choose to do this in an electronic format, but it's an example of how there's a time and place for everything. You want to pick the time that you're going to awaken, when you're going to do your meditation, when you're going to have coffee with your significant other, when you're going to do your exercise. This is how we create a balanced life. Now, coming back to this idea of being fully present and doing one thing at a time, what we're doing at this particular time, whatever it is, that's what we're doing. If we're for a walk, we're just going for a walk. And the idea then is to keep the mind centered on going for a walk. If this is the time when we're going to respond to emails, then that's the time we're going to do that. It's not about multitasking. It's not about blending all these things together that the mind is telling us we need to do. It's making time for things, and then that's when it's done. So it's not that when we live in the present moment, there's never a time to plan. We can plan. This can be the time for planning, you know, what we're going to do in a few days. But it's not about letting the entire day become planning. So activity schedules are another thing that are on our website that we highly recommend to people so that they can build a more balanced life. When we talked about just the simple breathing techniques that can be used to bring us back to now, just becoming more aware of those techniques and being able to notice the changes within ourselves. So we can say, I just did breathing alone. And before I started, you know, rating, this was how tense or anxious I was on a scale of from 0 to 100. And then just after 4 or 5 breaths or 5 minutes, when we're just out of thinking for a few minutes and we're really into being, how do I feel at the end? I had a gentleman that I worked with the other day, very lovely person who he's a cancer patient. He is in remission, but he was doing his physical therapy exercises. He was riding his stationary bike. He took his dogs for a walk. And when I spoke to him on the phone, he had said when he woke up in the morning, he started off with an anxiety level of 90. But after doing his exercises, he was down to around a 40. So, you know, just doing these physical exercises was such a help to him. And then when we spoke on the phone, I said, let's do a meditation together. And we did a 5-minute meditation. And when we got to that point, he was now down to a rating of around 20 to 30 in regard to this tension. So the important thing about that is the power that we have to make these changes within ourselves. We're not powerless. We can make these changes. Even someone that's suffering from a severe physical ailment. The other things that I think are so important at times like this is to focus on gratitude. We know that when people focus on gratitude, even at difficult times, it completely changes their outlook. So a gratitude journal, and these are just some examples of how you do that for people. And then here's the journal itself. The things in the world in my life I'm grateful for and appreciate. At this time, we should really be working to build this as a new habit in our lives if we don't already have it. But the negative mind tells us, oh, there's nothing good going on. That's not so. The kindness of strangers. I've had, my wife and I are in our mid 60s, and we've had younger, you know, families where the folks will come over and say, is there anything that we can do for you? You know, I mean, luckily we're still in good health and we're okay, but just the kindness of that. We want to look at, you know, all these things that we have in our lives that we overlook because we think that they're not something to be really grateful for. We think they're owed to us. And so we really want to cultivate this gratitude practice. And so this is a little journaling activity that we can do. We want to express gratitude to others. We want to tell people how important they are. And when we do look at life in this way and realize in a situation like a pandemic, life is short and we don't know how long we're going to be here. So again, all we can do is live in the present moment, and we don't want to live without regret. We don't want to live without regret. We want to thank people and appreciate people. My wife and I were talking about this morning when we were having coffee before our meditation. All the people in our lives that have helped us along the way, and all the people that we want to still be able to help. And what we learn from our gratitude, when we really are more grateful, more present, more appreciative. What have I learned from this practice, this simple journaling? What many people want to do in psychological journaling is they want to tell, and it's often a story that's true. It's often a story that they think is true, but it's their story. And it may not be the positive story that we really want to create. But through creating stories through gratitude, it's much more aligned to our true selves.
Dr. Passaro, if I can jump in here for just a second.
Please do.
We've been, well, two things. First, we've been going now for about 50 minutes, and I do want to make sure that we get to some of the questions that folks are starting to ask. And I want to remind our viewers that you can ask questions. So please do use that Q&A function that is part of the webinar tool, and type your questions in, and I will feed them to Dr. Mensa and Dr. Passaro. One thing that really resonated for me, just listening to you speak regarding gratitude, and I've had other professionals tell me pretty much the same thing, how important gratitude is. And I can't claim this as my own idea. Someone gave it to me, but they gave me a smooth stone that I keep in my pocket all the time, with the intent that every time I feel this smooth stone in my pocket, I'm supposed to think of 2 or 3 things that I'm grateful for. And that's been a very good tool for me to always be thinking about this concept of gratitude.
Dr. Passaro,
go ahead.
This whole thing of gratitude is so intriguing because, if we think about how we're being conditioned in our Western culture, we live in a consumer-driven environment. Everything is about more, 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 which is really indirectly saying, don't be satisfied with what you've got. There's always the next this, the next that, the most up-to-date, the better, as opposed to thinking, hey, this is really great. Of course, the economy go broke if we stayed that way, but the idea here is that we are very well conditioned to not be really functionally grateful. It's the next thing. What is the next thing? We need more and more and more. And if you're blessed to have that capacity, then you feed more into it very consistently. So I'm glad you brought that up. And would you like to touch base upon that a little bit, about our culture?
Sure.
and that drive that we are bombarded with all the time?
Absolutely. I see so many young people in my practice who live so completely in the future. I'll have a high school student, for example, a bright young man, who wants to go to medical school, like you, Dr. Mensa, and he'll be sitting there and he'll be telling me, the parents will have brought him in because he's overwhelmed with stress, sleeping 3 or 4 hours a night because he's in high school, and it's like, I have to take all AP classes in high school so that if I take these, then I'll get into the right college. And then if I get into the right college and then I do well enough there, and work myself, in this way, then I'll get into medical school. And then once I'm in medical school, then, I'll accomplish this. And so here's this, 16-year-old man, and this is the young man, this is what he's telling me now. I'm just kind of listening to this story. And then he tells me, and then once I get through medical school, then, I can, get through residency, and then I can, have my practice, have my home, and then I can have my car, and then I can get married, have children, and all that, and then everything will be okay. Then I'll be able to be happy. And so I'm sitting there thinking, wow, boy, have we given you the wrong message.
Mm-hmm.
Happiness can only be found in the here and now.
Yes.
But what we've done is we've told people, and we've really lied to our young people, that happiness is only in the future, and only when you've accomplished something externally.
Mm-hmm.
And so one of the things that I really try to do in my practice is explain to people, those are wonderful goals in life that you want to serve in that way. But you don't need to delay your happiness in the meantime, and you shouldn't be wrecking your health to get there.
Right.
And so, again, what kind of position is this young man going to be? He's clearly not going to be present and available for his clients. And so this is something I see in people and then I'll see people at the other end of that continuum where they are these highly successful people. They've done all the right things. They've gone to all the best schools, and they come in and they say, I'm incredibly healthy, I'm successful and relatively wealthy, and I'm miserable.
Mm-hmm. Yes.
Because they've been told happiness only existed in the future. And then they got to that future and they realized, hey, wait a minute, this happiness isn't here. So I think it's such a disservice. And so the more we can help people to understand this now, the happier we'll be. My meditation teacher taught this very idea that you're saying, that we need to live more simply. He said, live completely in the present moment, and the future will take care of itself. Fully enjoy the wonder and the beauty of the present moment. If we can teach that to people, that's going to help them with their physical health, their mental health, their social health, everything.
And aren't we really referring to what has been the age-old concept of balance?
Absolutely.
Certainly you've got to do a little bit of planning for the future, but so many people today stay in that race, if you will, of thinking, well, what about 5 years from now, 10 years from now, and so forth, as opposed to coming back and saying, I did that. Now let me enjoy the now. I'm so glad you brought that up. That was absolutely so important and so critical. Having lived that life you're talking about.
I'm sure.
Many professionals are miserable. They were told,
absolutely,
end of your your deprivation, your delayed gratification, all these wonderful joys are there for you and waiting, and the rainbows show up and the angels are singing them. No, you end up with more responsibility, less time, and more stress. And the suicide rate among certain professionals is extremely high. And it's because we are promised things in a certain way, in a certain fashion, that aren't true. And if someone would have told us 20, 30 years ago, 30, 40 years ago, for some of us, listen, enjoy this now, you'll get there. This is how you move into that while enjoying this. So you don't isolate yourself and separate yourself from the loved ones you really wanted to spend time with, but couldn't, or felt you couldn't. And you went to the extreme. No balance there.
Exactly.
Yeah. Thank you so much for bringing that up.
Well said. Yeah, exactly. And I think it's not, people will hear this and they may think, well, they're talking in all or nothing ways here, that I'm not supposed to plan, I'm not supposed to work. No, that's not so. It goes back to that activity schedule that I was showing. There's a time and a place for everything. And we need to create balance in our lives. That's really what we're really trying to say, is that it's not an all or nothing. Of course, we all have to work in this world and serve. But it's about not doing that all of the time, and not allowing our minds to be doing that work when we're supposed to be with others. That's really, the message here. So, and, it's this idea, I think, again, of finding balance, and one of the ways, this is another one of my high-tech charts, but it's about this idea of accepting things as they are that we can't change, living by our values. You know, it's being in that space between those. This is where we can really have our impact, the things that we can change. And one of these things we can change is living in balance, being present and available in whatever we're doing. And particularly when we're interacting with others, because obviously, you know, if you're physically ill and you go to your physician and he's on the computer and not even really looking at you and talking to you, where's the presence? Where's the therapeutic connection? Where's that trust?
And I can tell you, along those lines, most physicians are not happy with that model. It's something that was thrust upon us, and we're very, very unhappy and unsatisfied with having to do that, to the point where some physicians won't do it until the end of the day. Then they're spending 2 or 3 hours trying to catch up. Then they decide it's just time to retire. They're not going to do that anymore. Dr. Passaro, I want to make sure we have plenty of time for questions, because you've given us such a wealth of information and a wealth of approaches. Is it okay if we go to questions at this point?
Oh yeah,
please.
We're already there.
Okay.
and I've got a really good one here, actually, that kind of deals with this topic that we've been talking about in terms of being present. And I'll read it here because I think it's very well worded. It's fun here. While I really love my family, being stuck here in the house with the same few people for weeks on end is driving me nuts. And they don't seem to get it when I try to go off by myself by either closing the door to my room or sitting alone in the backyard. Can you tell them that having alone time is good for us right now? Or tell me if I'm being selfish and hurting myself and others by wanting to be alone?
I think it's a wonderful question, you know, and I think it brings up these ideas of what I should be and shouldn't be and how it's all supposed to be. But we all need time to recharge ourselves. And to that alone time, that downtime is a wonderful, you know, thing. I was talking to someone the other day who I was explaining that I have an old friend who was a monk who had actually worked with Mother Teresa in India, and she stressed so much to the lay members and the clergy that were working with her. We have to take time every day, you know, for our spiritual life, for our practice. We can't be serving all the time. We have to be able to withdraw to our room and have that time, you know, for spiritual practice. And so people need that time to recharge, that alone time. And that should be taught, you know, to our children. You know, it's like they need to be able to play by themselves a little bit, and we need to be able to have that time by ourselves. And so we don't want our significant others to think that we're running from them or avoiding them, but we all need that time to go within and recharge. So it's an absolutely appropriate thing to want to do.
And you know, it doesn't have to be a giant piece of time all in one setting. You know, people talk about micro naps, which may not be a good idea, but you can certainly take micro breaks. You know, after an hour, you can get up for 5 minutes and just go sit somewhere peacefully, even if it's just for a couple of minutes here and there. You can do that, and that really works very well for many people who can't create that, you know, entire space, because we've got kids around and we've got spouses around and so forth. But what do you think about that, Dr. Passaro?
Well, I think it's a great point. I think and because in you know, when particularly, you know, when I have 3 adult children and now have grandchildren, you know, absolutely, the idea of when you're really living in the moment, then that's something that you can do effectively and efficiently. That ability to take those breaths that I talked about can be very, you know, clearing, very revivifying, very restorative. You know, it's really watching, if you watch closely, what's really happening when we're getting overwhelmed is the mind is getting overwhelmed with all the thinking, with all the problems. You know, the more we're present, the more we're appreciating, the more we're calm, the more we're going to be able to really be in these, you know, complex situations. If we watch closely, the overwhelmed nature is really a function of the mind. And the calmer we can be, The more we can be practicing our breathing, the more present we can be, the easier all this becomes.
Thank you, Dr. Passaro.
Very good. We've got a patient here, a viewer here who claims that he's also an autism patient, and says that he's got 5 or 6 obsessions, that oftentimes he gets so obsessed with one thing for weeks on end, he won't want to do anything else. And then he goes to one of his other obsessions and doesn't want to do anything other than that obsession, leaving the first one behind, and is concerned that these obsessions are contributing to mood swings, to other forms of imbalance, and is asking how he might be able to overcome this obsessive behavior.
You know, I think it's a wonderful question, and we all, you know, obsess, but obviously, you know, this is, you know, partially part of caring. You know, that's just, this kind of goes with, you know, being, you know, being wired with autism spectrum disorder. And I think it's very, very important to really approach this very holistically. So there's absolutely nothing wrong with taking medication if that is what's needed, but certainly, you know, working with from a functional medicine, integrative medicine approach, the way you do at Mensa Medical, very important. You want to look at that as an element of your treatment as well. You don't want to think about this solely as a psychological treatment. You want to look at pharmacology. If your physician recommends that, you want to absolutely look at natural interventions and healing. You want to look at your diet. You want to look at your exercise. You want to look at all these variables in regard to that treatment. But we do understand that mind training, which is really what we're talking about here, is absolutely essential. With that said, there's a wonderful protocol out of UCLA called the Brain Lock Protocol. And you can find this book. It's called Brain Lock by Jeffrey Schwartz. This is what I would recommend for this individual. Brain Lock by Jeffrey Schwartz. And it explains how obsessive thinking works, the area of the brains that really get locked into this, and a simple protocol that helps us through mind training to be able to release from that. But I wouldn't approach that alone. I would absolutely be working with a physician like Dr. Mensa to get a very integrative view, because again, we're bodies and minds. These two things work together. And so, but the medical work plus the psychological work would be my recommendation. Dr. Mensa?
No, I thought that was great advice. I have nothing to add to that. Fabulous. There's so many of our patients who ruminate, who obsess, and it takes over their lives. It makes their family members miserable. So I'm glad. I love that book. I think that's something we should take a look at and see what else we can learn from a lot of these other approaches and therapies.
What I'd like to do, if it's okay, Mr. Wells, is just real quickly point to one other book while we have just a little bit of time left.
Absolutely.
That I think would hopefully be helpful to everyone. So let me do this. And then what I'm going to do is, our website is the Anxiety and Depression Center in Newport Beach, California. And so what I want to be able to point to is that there is a book that our center director, Dr. Dennis Greenberger, has written called Mind Over Mood. The worksheets and the overheads that I've been sharing today are from this book. And so you can go on our website and you can click on Mind Over Mood, and you can go to sample worksheets. And the worksheets that I've been showing you today are right here, and you can download these and print these. The book itself is something that people may want to use for self-help. It addresses anxiety, depression, anger, guilt, shame, and it's solid scientific evidence based in regard to how to do that, and it uses an instructional format and worksheets. And so for people wanting to be able to help themselves, this would be one book that would certainly be able to do that for them. I did want to just briefly say that if people are interested, our center is also going to operate online a Mind Over Mood group, which can be something that could be very, very helpful for people. They can have, there'll be a therapist actually teaching more and more of these techniques as people would want to learn them. They would have the book as a reference. And so it would really be a form of group therapy that can be offered at a much lower cost than individual therapy for people that might want that. But that would have to be for people in California because of the way licensing works. But the book is certainly something they could use no matter where they are. And I should mention, if you are trying to find a good therapist in another state, then a very good website to do that, to find your, is called the Academy of Cognitive Therapy. If you go to the Academy of Cognitive Therapy, you'll be able to type in your location and they'll identify for you people within your region that could provide this quality of care for you. And now with teletherapy, they could be anywhere in your state and you could work with them because you wouldn't even necessarily be going to their office. So those would just be some resources I wanted to make sure we left people with today.
Thank you, Dr. Passaro. That's extremely helpful, extremely helpful. Mr. Wells, do we have any other questions?
We've got just a couple more, and then I want to make sure that we do leave a little bit of time for Dr. Passaro's guided meditation as well. So I've got one question and one statement. I'll go with the statement first. One of our participants in New Jersey just noted that since the stay-at-home mandates have been put in place, he or she is sleeping better, has the energy to keep the house clean, much more relaxed overall. The statement is, it took a global crisis for me to see all this. I'm actually grateful to have this opportunity and intend to take full advantage of it. I'm not looking forward to going back to normal, but I'm also not worrying about the future of going back to normal to interfere with the enjoyment I'm experiencing now. So obviously this viewer is taking good stock of the thing we're talking about today.
They figured it out. Good for them.
Absolutely.
Yeah.
Good for them.
And the last question that I've got here today before we get to our breathing exercise, or our meditation exercise, I'm sorry, is one that's actually very, very pertinent to the overall theme of our visit today, talking about how all of what's going on with COVID impacts the stress and anxiety and depression that we're dealing with. The question is, we keep getting different information each day about how to avoid the virus and how to treat the virus. We hear that we shouldn't wear masks, then we hear that we should. We hear that the drugs for malaria are effective in treating the virus, and then we hear that people died trying that drug. We hear that a vaccine will be ready in weeks, and then we hear that it might not be ready for nearly 2 years. How should we filter this information, and how can we help but be stressed out when all the information we keep getting keeps changing?
I want to address the first part of that, and then Dr. Passaro, I'd like you to address the second half of that question. First of all, unfortunately, the dichotomy you're hearing is somewhere between medical professionals and then people who are non-medical professionals, okay? The vast majority of medical professionals are in agreement with regard to certain dynamics in the flow and the evolution of this process, including treatment, okay? Unfortunately, people who are non-medical personnel begin talking about these outliers and trying to push them in a certain direction, and then it takes on a life of its own. I think the safest thing to do is to talk to your medical practitioner. You have a doctor, hopefully you have a doctor, but he's your doctor or she's your doctor for a reason. That person knows you. That person knows your history, knows how to care about you and take care of you, and they're best able to answer those questions for you. I had a young man contact me today because he wanted me to talk to his significant other who is operating in the field with the COVID virus, and some things that are do's and don'ts that he wanted me to share with her. And as I was talking to them, and these are young folks, they're, in their 30s and in love and stuff like that. And, what I had to share with them was that, look, you are you, Mr. So-and-so. She is herself. And the two of you are not the same. You've got different environmental exposures. And so the things that you want to do are different. You're individuals. And so your primary care practitioner is really the person you should be talking to. I can tell you the vast majority of us are sitting there looking at the evolution of COVID like no one's business. Even in the news, they talked about how there hasn't been a phenomenon that has moved so many scientists, physicians, and medical practitioners into evaluating one particular thing globally. We're all talking to each other from around the world. A lot of my insights do come from overseas. So please talk to your medical practitioner if you want to know what's really working, what's not going to work. And that'll help keep you focused and directed and not worry about what other people are saying. Dr. Passaro.
I think one of the things that we understand really clearly about things that activate anxiety is a sense of uncertainty.
Mm.
Our minds want certainty. They desperately want certainty. They want things to be known, to be predictable. And when we're living in an uncertain way, like we certainly are now, it certainly activates people's anxiety. So much of the work of acceptance and commitment in regard to treatment is about accepting this uncertainty as opposed to resisting it and fighting it. I want to know exactly what's going to cure the virus, exactly what I should do. We don't know that. It's dynamic, it's in flux. We don't have certainty. So we want to observe within ourselves how uncertainty disrupts us and to be aware of that, and then to say, okay, these are the things that I know today. It may change tomorrow, but based upon what I know today, this is how I'll live today. I'll adapt and I'll modify my thinking based upon solid medical advice as it changes. But I have to learn to get comfortable with uncertainty. And that is such an important part of the mind training, the cognitive behavioral therapy that we've been talking about, getting comfortable with uncertainty and being able to face our fears.
Wow, that's powerful.
Yes, absolutely. Absolutely. Well, Dr. Passaro, we've got about 10 minutes left here. If you would be so kind as to share with us some meditation tools that perhaps our viewers can use to put themselves back in that place of balance.
Absolutely. Give me just 1 second and I'll get ready to do that. And then I want to do just one or two other things here. I want to make sure that people know how to reach me if they have questions or concerns. This is our center. This is our phone number. And then I'm also going to put my email out here so that people can reach me as well. Thought I had it. Oh, I know where it is. Right here. So feel free to email me at that address. If you have questions, concerns, if you have trouble getting on the website, finding the guided meditations, if you have trouble getting to the handouts, and then if you have interest in being in a group, that would certainly be a way, to find out more about that. So I want to make sure people have that information. Okay.
Thank you.
You bet. So and this is a practice that is really well grounded in multiple sciences. So what I want to talk about is that when we have just a few minutes, it can be as short, as 5 minutes. and we can have a time and a place, and this would go in the activity schedule of when I would really try to find a time and a place to practice. We can be outside if the weather is permitting, if that's the best way to get away from things and be quiet. If we have a place within the home that we can have, we want to find a comfortable setting. So we want to find, you can, if you're a yoga practitioner, then you can certainly sit on the ground in lotus posture. You can sit on your bed. You can be in a chair, whatever's comfortable for you. The idea is that you usually don't want to lie down in meditation because you can fall asleep. So the idea that you want to generally be sitting up, and you want to try to keep a good posture, meaning that you want to have your back straight. You don't want to be slouching. So you want to have your back straight. You want to have your shoulders back and your chest slightly out. And then the hands can rest at the junction between the thighs and the abdomen with the palms facing upward. And it's generally best to close the eyes in this practice. And the thing that I want to mention is that there are 3 planes that the down plane, when we're going to be tired and fall asleep. This plane that our eyes are on normally, as they've been during our talk today, they're on this plane of the world and we're wide awake. But what we want to try to do in meditation is just raise that plane just slightly, and to concentrate the eyes while closed, just slightly lift the gaze to this point between the eyebrows, because it will help us to not fall asleep, and it'll help us to elevate our consciousness just a little. And so if we can concentrate there, and then this is an exercise in dual attention. So we're concentrating on more than one thing at a time. And so as we're concentrating there, now we want to come back to that breathing technique. And we want to breathe in, and what we're going to do right now is we'll breathe into a number, and everyone will find a pace that's comfortable for them. So it can be an inhalation of 4, and and then we want to hold to the same breath, and then exhale. So I'll just use an example of breathing in to a count of 4, gently holding to a count of 4, and breathing out to a count of 4. And what I'd like people to do is to visualize the breath coming into and out of their heart. So visualize the breath coming into the heart, holding for the same count, breathing out through the heart. And we just quietly do that. Find a rhythm and a breath, eyes closed, gentle posture, slightly uplifting the eyes and breathing in. Holding to that same count and breathing out. Now the mind will wander as it does. Problems will arise, ideas. Just let them go and bring the attention back to the heart, to the breath, and to the point between the eyebrows. Just keep bringing the attention back there. You may notice as the body becomes calmer and the mind becomes more settled, you may feel some peace at the heart. You may feel some energy at that point between the eyebrows. You may even see a light there. Just concentrate on those sensations. Every time the mind gets engaged with what the mind does, it's okay. Just notice it without judgment and come back to the breath, come back to the heart, come back to that focus between the eyebrows. And what you want to notice when there is some calmness is notice how clear the mind is in the place between the inhalation and the exhalation. That's the point of really deep peace, because there's no breath going on now. So watch that. Notice breathing in, and then notice when you're holding the breath for that same count. Notice how calm and still the mind is when there's no breathing. When we're in the fight or flight response, our breathing is very rapid and our mind is racing. And when we're in this parasympathetic state, you can see when the breath slows down, then the mind slows down. When the mind slows down, the body slows down. You have this portable peace within you through just these simple techniques. Just sit in that silence between the inhalation and the exhalation. I'm going to just ring a bell in the meditation. And now we're back more ready and more refreshed to be present and available in life and for others. And that only took just a few minutes. It's there for you all the time.
Thank you.
No one even needs to know you're doing it.
Thank you for that. I'm feeling better.
Me too.
Great. Great.
Wonderful.
Glad to hear it.
Well, thank you,
Mr.
everyone. Yes, please, Dr. Mensa. Did you have something?
Are there any other questions for Dr. Passaro?
No, I think we're good with the questions for today. I wanted to thank everyone who did tune in and join us for this webinar today. Remember again that we will be uploading this a little bit later on this evening to YouTube, and we'll make links available to that YouTube video on the Mensa Medical Facebook page. So certainly you can go back and watch this again. You can use that wonderful technique that Dr. Passaro just shared with us with his guidance anytime that you need it. We encourage you certainly to share it with your friends and family as well. We will be back again next week. Dr. Passaro has graciously offered to be with us again next week so we can talk a little bit more about these important issues and focus a little bit more on depression. We talked a lot about anxiety today. We'll talk a little bit more about depression next week. In the meantime, be safe out there, and we will see you in a week's time. Also, don't forget that we will be back again next Thursday as well for the final installment of our series on nutrition with nutritionist Samantha Gilbert. And we've got another group of webinars coming up in the weeks that follow related to therapy and working with psychiatrists and psychologists and the like. Dr. Mensa, you have—
I want to jump in here, and because I have to thank Dr. Passaro, truly from the bottom of my heart, from the apex of my myocardium, as we would say in our field. You've been absolutely enlightening, a joy, and something very different from what our audience is typically used to. And it is so comforting to have these kinds of discussions and exposures. And we look forward to having you back next week. Absolutely. I'm hoping that we're going to make sure we talk as much as possible about you coming forth, so that we'll have a great audience with greater participation so they can experience what you have to share. It was tremendous. I enjoyed it personally. Mr. Wells did, I'm sure. And I think I'm pretty sure our whole audience did. So thank you so much for sharing your wisdom and knowledge with us. It's greatly appreciated.
My pleasure. My pleasure. My honor.
Very good. Thank you again to both Dr. Mensa and Dr. Passaro. Thanks to all of you for joining us. We'll see you next week.